Hello, I'm Dr. Prabodh Karnik and I'm the ENT surgeon at the SRCC Children's Hospital managed by Narayana Health, and this is at Haji Ali in Mumbai. My special interests are treating children with issues regarding the ear, nose, and throat. Will you bring your child to me every time he has a little bit of a sneeze after he goes into a garden? Or will an infant be brought to me every time he's tugging at his ear and has a little pain? Or sometimes mothers come to me saying that their adolescent has had fever and throat pain after a birthday party. And I ask them, is this the first time it's happened? And they say yes. And realistically speaking, I'm not so sure if one episode of pain or trouble in the ear, nose, and throat has occurred and it is short lived, you really need to see an ENT surgeon. Probably these issues could have been sorted out at home because most ENT problems are self limiting and resolve by themselves. Or your trusted family physician or your pediatrician can also help you out. Problems in the ear, nose, or throat which are persistent, which have a pattern, meaning thereby that the pain or the complaint in the ear, nose, and throat doesn't happen one day, today, and after 2 months, and happens after 3 days, and happens after 6 months, but keeps on happening. And if it keeps on happening with increased severity, or if the complaint regarding the ear, nose, and throat is so severe that it is impairing sleep, regular function, play, and the child is really uncomfortable, then I think you must see an ENT surgeon. Let me give you some concrete examples. One episode of ear pain certainly doesn't need an ENT surgeon to look at. But if the pain is severe, child can't sleep for more than 2 nights, or it's accompanied with fever and sometimes hearing loss or any other thing, then you need to see an ENT surgeon, especially if the pediatrician or the family physician has suggested so. Let's assume the child has ear discharge. A simple watery stringy ear discharge might be because of inflammation of the outer ear canal. But a ear discharge which is foul smelling, which is scanty, sometimes accompanied with fever, and God forbid if it is accompanied with headaches or with nerve paralysis or with any other complaints that are outside the ear, then you must seek an appointment with an ENT surgeon. Similarly, in the nose and the throat, a little bit of sneezing, a little bit of nose block, and a little bit of a cold, I'm sure you must be treating with your regular medication in the medicine chest that you have at home. Or you probably ring up your family doctor or your pediatrician and he prescribes you some medication on the phone and the child becomes okay. But if sneezing, watering, nasal block impairs school going, it impairs studying, it causes a lot of distress to the child as well as to the family, I think a ENT surgeon can produce a lot of more input. Throat pain after a birthday party, gorging on wafers and all those carbonated drinks is fairly normal. A day or two of trouble and most children become alright. But if repeatedly you get throat pain with fever which is high, and during those episodes of throat pain you are not able to eat, you have a lot of snoring, you probably have enlarged tonsils and adenoids, which are very often the problem in childhood. None of us ENT surgeons remove tonsils and adenoids without any reason. But they must be shown if more than 2 or 3 episodes occur in rapid succession. So, in short, children who have persistent problems or problems which are increasing in severity or in frequency, or problems that have a pattern related to the ear, nose and throat, you must bring them to an ENT surgeon. Huge advances have occurred in our ENT specialty. Children who were born with hearing loss and who probably may not have ever spoken if they were not cured in time can now be cured with a cochlear implant. Sinus infections, nasal infections, or injuries to the nose and to the brain can now be treated with minor small telescopes put in through the nose, and nasal surgery can be done. And patients who have hoarse voices or voice problems can also be treated with microscopic surgery and other forms of surgery. Do remember that an ENT surgeon is also involved in treating the external ear deformities, in treating external nasal deformities, and some form of plastic surgery can also be done by the ENT surgeon. At times, other specialists like the neurosurgeons, like the thoracic surgeons, like the pulmonologists or the lung physicians call upon the ENT surgeon to help them do some surgery via the nose or via the throat. Sometimes the ophthalmic surgeon or the eye surgeons request the help of an ENT surgeon to help operate on the tear sac as well as on injuries or problems on the nerve of eyesight. Do remember that both these structures are between the nose and the ear, and sometimes the ophthalmic surgeon requires the ENT surgeon's help. In short, an ENT surgeon is a versatile physician and a surgeon for many issues from dura to pleura. This is right from headaches to thyroid problems to voice issues to hearing losses to sometimes eye issues to sometimes lumps in the neck or in the jaw or problems in the teeth or the tongue. ENT surgeons are very well equipped to manage these problems. Thank you.